welcome back. You are still tuned in to Talk the Ting with Kim here on Funtastic Fridays, alright? So if it is that you're just joining, we're talking about the importance of a healthy smile.
Yeah.
So if it is that you missed it, just know that every single Talk the Ting with Kim episode is recorded and it's shared on our YouTube channel. So guys, I'm telling you, we have learned a lot of things so far in the first half of this interview. So you're gonna want to check it out if it is that you missed it, alright?
Alright.
So I did touch on the fact that I had a question that I was looking forward to talking about. And yeah, it's about time. Let's get into it.
Okay.
How does excessive alcohol consumption, because we know enough Jamaica, we're to talk about flossing earlier. How does excessive alcohol consumption affect dental health?
Well, Kimmie, I pick power.
Yeah, I had to. I know no people out here probably a side eye me and all these things, but it's
So
fine.
how does excess liquor flossing?
Yeah. Liquor drinking.
Yes.
Yes. How does it affect our dental
I
health?
see this is a topic near and dear to your heart.
No, for our listeners of this, we are here for the people.
There's certain people.
Yeah. We're here for the people.
Okay. All right. So let me back up a little bit and talk about saliva.
Okay.
Right. So saliva is really, spit.
Yeah.
It has a lot of good properties.
Yeah.
It is antibacterial, helps to keep the mouth, from
Moist.
drying out.
Yeah.
Yeah. And so we need saliva. In fact, I have some patients who do not have good saliva flow, and it results in more cavities, more lesions, meaning cuts and that kind of thing on the gum.
Wow.
Right. So alcohol use, excessive, tends to dry the mouth.
Yeah, because the mouth gets dry. Yeah.
So, alcohol use in moderation, you know what I mean?
Yeah,
Yeah,
we're not
everything
saying
in
don't drink.
moderation.
Yeah.
But excessive drying and that can lead to some problems.
Oh.
Okay, I had to touch on that because it's something I didn't
That's
even
right.
work out the maths, but when you drink, especially some
It's
alcohol.
Okay. No, if you pass it at the establishments them and you see some of the seasons veterans in there, they never I try,
Yeah.
What do we do?
Yeah. Wow.
No, I love that we touched on that. So
Yeah,
guys, if you are, we're not saying you cannot drink. You can enjoy your alcohol,
Responsible.
But once again, excessive alcohol, it doesn't help anything.
Yeah.
And I like that you mentioned the saliva part because when I did get my cleaning a couple weeks ago, that was one thing the dental nurse said. She's like, "Oh, you have all the saliva," and I was like, "What does that mean?"
That's
Like,
a good thing.
I'm not sure where we're going. She's like, "No, it's a good thing."
Saliva?
Too much?
Yeah. You produce too much.
I mean, if you're drooling all the time, but
Might
apart
not be
from that,
safe.
apart
Okay.
from that,
Alright.
Because that was my question. I was like, what does that mean? Because, I'm waiting
good
for the...
thing.
That's what
It's
she
a
said.
good
She
thing.
said it's a good thing. And just say, it helps to prevent bad breath. And she'll tell me all the things that it does. Because every time she was doing the cleaning, like, I guess saliva just kept building up every
It's like,
second.
whoa there. Alright.
So, I was like, all right, once again, felt good about myself.
Okay.
I mean, I didn't even know I had sufficient saliva, but I feel good about it, right?
She's got it, people.
But we want to touch on as well smoking. I almost said smoking because I know most people already associate smoking not to be good with dental health, right?
Yeah.
But is there a difference between smoking cigarettes versus marijuana?
Or
is it that, let's start with that. Is there a difference? Because some people feel like, okay, if I smoke marijuana, it not really have that
Smoking,
effect.
first of all, smoking not good for you.
overall,
So
right.
any smoking is still
So,
not good.
I'm just going to say that. Just going to put that out there.
Yeah.
In terms of degrees of severity, anything with tobacco in it,
Yeah,
It's
it's
gonna be
worse, right?
Yeah.
Okay.
But you're saying marijuana still affects
The smoking.
lesser.
this.
Mhm.
Okay.
Lesser, but it still
Still,
affects
okay.
negatively.
Okay.
Right.
All right. That's important for us to cover.
Mhm.
So now that we know,
Well, that's what the studies say. So,
oh well, I see a question from Stephen Blake saying, "Hello guys, I have a question for the good doctor.
All right.
Can I use safety pin to clean the teeth?"
Wait there.
Answer the people that question.
Come on. I
Uh,
mean, like the comb teeth, the comb teeth, to clean out.
Once again, can I use
Cannot be
safety
human
pin?
teeth. Cannot be human
to
teeth.
clean in between the teeth.
I'm guessing the flossing or the little getting things out Oh, and also vaping is another question. There's vaping also. So let's start with the safety pin part.
Right. I would stick to floss.
Yeah.
The safety pin kind of seem like we might injure. So
Exactly.
And what about when we use like with fingernail?
They might get juke.
I wouldn't put the fingernail between the teeth.
Yeah.
You know, we tend to do that. Maybe when you're nervous,
Yeah, when you are
when your hand dirty,
Yeah.
and you don't know, you know, COVID
Yeah,
and
teaching not
things
to put
around
your
now,
name
so
out
we
too
don't want to.
often.
We don't want to do that.
Because usually the first goes in, somebody says something in your
I mean,
teeth and
some of
all of
your
a sudden
teeth
you
is
just
what we
No,
go
don't
to.
do it.
don't do it.
I
Better
mean,
go to the bathroom, man.
I mean,
If your hand
if
is
you're roughing
clean-
it, use a toothpick. You know what I mean?
Okay, yeah.
If you're roughing it.
But no safety pin.
Or for the
No,
for the
please.
thugs on the street, what, like a matches stick.
Well, I guess a well sharpened matches stick would work, but I would prefer a.
The amount of time you
Use the
spend,
toothpick.
the amount of time you
No,
spend at sharp
Jamaicans they pick it until it's sharp and then I've seen this happen.
Oh
You know.
my
They
god.
pick it until it kind of have like a point and then they start to
Well, you see, this is the perfect time to segue back into the thing you mentioned earlier, right? A lot of Jamaicans love to chew bones.
Right,
And you were mentioning that that's not good.
right.
it's not.
Can you let us know why it's not good?
Okay. Practical example. Let's say you have a cavity you don't know about,
Mm-hmm.
and you're chewing the bone, the hard bone,
Mm-hmm.
and because the tooth is a bit compromised, you end up breaking the tooth,
Mm-hmm.
and now you might have to extract,
Mm-hmm.
right? And the same thing goes for ice. I cannot tell you the amount of people I've had come in who've had teeth that are broken because of either ice or bone.
Ice or bone?
Ice
Break
or
your
bone.
teeth.
Ice or bone.
So hold on there.
Take time with the ice. You know, you have some ice with the ear in between it.
Yeah.
And it's softer.
Come on,
You
right.
can chew
the
the
soft
pine.
eyes will go
They have
down
the
the
tough
bone.
one, them.
But the one them
The
when
firm.
you're putting in your ice
Freezer
tray
for the
and
big
it's
buckle of
solid.
the
No do it.
Really?
No,
I
do
used
it.
to be an ice eater, but I've stopped years ago.
You know, Jamaicans, we know how we stay. We have this knowledge where we put things to the test. We are strengthening them. And
That is true. We're straight with teeth.
No,
When we
don't
buy
do it.
ice or them something now.
I'll curry goat bone.
Oh no.
Oh
Not
my
even my
gosh.
dog will give them this. Better trust it. No, they're tough. Better trust it.
Oh
But
gosh.
really, like, I have a couple friends right now. Me I tell you, we should give them bone and a dust you get when they finish. If you see anything, a dust. So I'm trying to figure out.
You sure the bone them no pressure? Like
Me
it's
don't
before?
Me not know, like a
Tough
regular
bones,
my
anyway.
bone in my plate over for them plate at dust. So me I try to figure out if they have like stronger teeth or something.
No, it's dangerous.
It's
It's a dangerous
dangerous,
practice. If you want to keep
Oh.
your teeth, anyway, it's a
Okay.
dangerous.
So I tell them say for them own teeth safety.
Yeah. Alright, so I see some questions coming in, and I love that Kay Galloway dropped that question because I was actually gonna get to the point of anxiety. But before we do, let me answer the questions. Well, let me ask the question before. Someone on the live, AAL Blake, said vaping. Does that affect? Because we know we talk about smoking, but is vaping?
It depends on what's in the vape.
Mhm.
But I would generally think
Avoid.
avoid
Yeah.
Avoid it overall.
Some of the vapes have tobacco.
Right.
Some of them have all kind of chemicals that we
Yeah.
don't know about
Mhm.
in the vaping liquid. So I would be very careful about the
Yeah.
vaping.
About the
And it
vaping.
already has other,
Yeah.
health issues. So
Yeah, okay.
nobody take it up for your
Yes, it might
teeth.
dry out your mouth.
yeah,
Yeah,
there we
that
go,
as
there we
well.
go,
And
there we go.
you need the saliva for the health, healthy
Mhm.
saliva
Hey,
people here.
hey,
right?
all right.
Galloway
That's
says-
the work.
Galloway says no safety pin around here.
No, I was about to say, no
it's only
safety
it's
pin.
safe to pin stuff, not for your teeth. It's not safe for your teeth.
Alright, so I love that you mentioned safe for teeth because this question by Sanya is a question that also people have as well.
Right.
Does drinking water with lime or lemon and let's tie in apple cider vinegar in that because also weight loss things tell women or people overall, drink a tip a bit of apple cider vinegar, but
Right.
I've heard that that's not good for your enamel. So can we get into, water with lemon or lime?
Right.
And then what about water with apple cider vinegar?
So you remember when we were talking about sugar,
Mm.
Yeah,
and I said that it creates an acid,
yeah,
and lime is citric acid.
yeah.
So
It's already acidic.
So
That's
basically,
right.
drinking water with lime is not
but,
good for us.
I mean, it has benefits
Moderation,
for your
yeah. Other parts of your body.
you understand?
But no
Yeah.
soak your teeth in it.
No, what I would say is if you're gonna use the apple cider vinegar
Yeah.
or the lime juice,
Yeah.
the water, use a straw
Oh, so you pull straight past your teeth for
Right.
the most part.
and then rinse after.
Oh, that makes
Yeah.
sense.
Rinse with water after.
I've been using a straw
Mhm.
and it still creates two cavities.
at the bottom.
Wisdom too.
Right.
Yeah, 'cause that's part of the pulling process back there.
Right.
So
rinse after as
yeah.
well. Not
Right,
just
so
yeah.
that's what I wasn't doing.
Yeah.
Rinse after.
Okay, I had to go into that because something I started once upon a time, the whole apple cider vinegar water thing, and they would tell me, oh, just use like a quart full in the cup full, and I thought I was doing fine with that. But then I started doing, because I always read up more, saw that okay, if you do it like every day or whatever, it could affect the enamel and so
it's an acid.
yeah.
Whatever you imagine you pouring an acid on something every day.
It's gonna wear it down.
Yeah.
Alright, what about a bit of salt in the water?
Salt.
Yeah.
For what purpose?
Just
No, but I always hear rinsing with salt water.
I've been told by the dentist to say, soak your teeth or your gums in salt water.
Yeah, man.
So,
after an extraction.
So what does that do? What's that?
All right. So the salt, bacteria they don't stand up well in salt water.
Okay.
So we want to soak the air in salt water so that it kills stuff and keeps stuff clean.
Okay.
That's basically why we do the salt water.
Okay.
So is it something we should do occasionally or only after like extraction?
If your gum is like if it's inflamed and
or stuff like that.
like for the first day you can try that, but if it continues for no long period of time, you need to go and see them.
Okay, so don't know salt water the thing every week.
Just hope speed for going. No,
exactly.
Okay.
We always wait till something where it's happening.
Yeah.
Alright, so Kay Galloway said, can you shed some light on people's fear of going to the dentist? Because it's a real thing, and she said covered face in shame. Great information though. So for persons who are anxious to go to the dentist or afraid, what advice outside of talking to the dentist, hope you reach to talk to the dentist now. So I thought before that.
Right.
What advice do you have for persons with that fear?
Can you go back to her question?
She said, can you shed some light on people's fear
Is
of
it a
going
real
to the
thing?
dentist? She said it's a real thing for her.
It is. Because, if you are extremely fearful about something, it's real to you.
Yeah.
Right? So a lot of people, they have fear of going to the dentist, maybe because they saw somebody having a bad experience on a show.
Yeah.
Maybe because they had a bad experience when they were younger.
Yeah.
And so it is real, unfortunately. But the only thing I can say to you is that dentists are here to help.
Yeah.
And we're not trying to cause you any discomfort or pain. We really want to take you out of pain and put you in good oral health. So, I don't think I've ever had a patient come in and say, "Boy, I love the dentist." Everybody is.
I've seen one person like that before.
You have?
Yeah, it's a crazy person though. But
okay.
No, you have certain people with some personalities. But
yeah.
So that I wouldn't say crazy, but yeah, it's eccentric.
Well, Tanya said, remember the horror movie, The Dentist? So she's telling you where her fear comes from.
No,
right.
But I must also say that is it like a requirement for dentists to be strong? Because I saw this little dentist, she took out my wisdom tooth and she was pushing on the chair, jumping off the chair. I never expected her to be so strong.
Well, when you practice in dentistry, you develop certain muscles.
No,
so you develop the muscle to remove.
I never know, so she could have the lady pull you. Because wisdom tooth extractions are
a bit more complicated.
Out of the norm, right? They're a bit more,
That is where the bone gets thick and we have vital structures back there.
She was rooting out and rooting out. Listen to me.
So something I wanted to touch on, if I a little bit. So we're talking about the dry mouth, which the clinical name for that is xerostomia.
Oh.
Right?
But we're going to stick with dry mouth because I cannot even repeat that word.
Or we can start with xerostome.
Right.
Yeah.
All right. So, alcohol use, but there are a number of other things that we do that can lead to dry mouth.
Oh, okay.
Right? For example, we have in the older population, a lot of us take a lot of medication.
Yeah.
Right? And the medication, often a side effect of a lot of medication, because, they're taking a lot of drugs and stuff.
Yeah.
It dries out the mouth, and then they're fixing one problem and then
causing the next one. Yeah.
So you have to be very cognizant about the medication. If you're taking a lot of medication and your mouth is drying out, you might want to start using a toothpaste that promotes saliva production, like a biotin. I'm not promoting the product, but I'm just saying.
But these are helpful options. Yeah.
Right. So you definitely want to keep note of that.
Oh, so you actually had toothpaste
mouthwash.
You have different
Toothpaste that have different
Yeah, of
benefits.
course,
That's
yeah,
it.
man.
Also, like dental and them stuff.
sensitive ones. I know a lot
Right.
of them that promote sensitivity.
Right.
But I never knew that there was one that promotes saliva. That's what I'm
Oh, that's
getting
true,
at.
man, that's true.
Yeah.
Oh, okay.
Yeah. They have them.
Yeah.
And so, what do you recommend to combat outside of like drinking moderate alcohol and eating better with more veggies and stuff like that?
Mhm.
Like, I guess the water intake is.
Yeah, man. Definitely water intake is good. We definitely want to keep, but we don't want to overdo it because you can overdo water.
too much water you can overdo.
Yeah, man,
So
you
how
can
much?
overdo
Because
it.
I've heard
For
mixed
your
reviews about how much is enough and how much is too much.
Yeah,
I think it depends on the person, to be honest with you.
Yeah, I heard
probably
eventually
even
it
the
depends
day
on
as
your
well,
weight
Yeah,
and
and
stuff.
the temperature,
sometimes
yeah.
the day had to a
Right.
bit more, you know. So
Right.
so you must, I guess.
Yeah,
Right,
you
right.
kind of have, but 8 glasses.
I think your body also tell you when this too much.
Mm.
Listen to your body
Some people
sometimes.
drinking a gallon, which might be on the high end for
Yeah.
most people.
Well, Stephen also said, what about sleep machines? Are they drying out the mouth too?
They can. Some people have sleep apnea,
Yeah.
Mm.
and they have the CPAP machines. But we should be taking, we should be using the saliva analyzer, we call them,
Mhm.
that help to keep the mouth in the right condition.
All right. So what I want to do now, I want to tie the conversation to back to school, right? Because we have kids going back to school. We know there has been some movements by the government trying to eliminate sugary drinks and
They had a
all the
promotion,
exactly for a while. I haven't seen it in a bit, but it
Right.
did happen. What tips you have for parents for the kids for back to school? So like outside of let's include because it's important a dental visit. What tips you have for parents taking care of the kids overall? I guess.
Cut down on the sugary drinks,
Mm-hmm.
more vegetables. Go to your dentist. Take them to the dentist every 6 months.
Mm-hmm.
And just follow up with them. And importantly, every child from 1 to 8
Mm-hmm.
dentally is the responsibility of the parent.
True.
So if your 7-year-old is not brushing their teeth,
Mm-hmm.
Blame the parents.
that's on you.
Yeah.
Mm-hmm.
You need to make sure that 7-year-old, that 8-year-old
Mm-hmm.
is brushing their teeth properly. That's the parents or the guardian's responsibility.
Yeah, man.
So is
follow
there
up with them. You know
follow
what
up
I mean?
with them? Because I realize that a lot of parents at certain ages, or they feel like the child, they're old enough to understand. So it's like, oh, go brush your teeth. That's not ideal.
No, you wanna make sure that you ingrain in them the right habits, the right brushing habits.
Mm-hmm.
So we definitely want to make sure that they're brushing for at least 2 minutes, right?
Mm-hmm.
If they have baby teeth, we might not have to get into the flossing, depending on what you say.
Yeah.
It would be nice. I would love that.
Mm-hmm.
But definitely 2 minutes of brushing for the young ones.
So what about Timmy doesn't like to brush his teeth, but them soon change out the teeth then anyway. How that go?
Right. So we need the primary teeth, the
Yeah.
baby teeth, to stay in place.
Yeah.
So if we're not brushing them, we're going to
They will
lose
still
them.
lose
We're
earlier
going
than
to lose them.
earlier than probably.
And then when you lose the teeth,
Yeah.
when you lose the baby teeth before the time,
Yeah.
what's going to happen is your adult teeth, they're going to come out in the wrong places.
Mm-hmm.
Oh.
And then now you're going to be talking about orthodontic treatment, which is,
Yeah.
Okay.
it's not the cheapest type
Yeah,
of
I've
dental
heard.
treatment
Oh.
that you can get. So
Okay.
I would recommend
Mm-hmm.
brush your teeth.
Yeah.
That way we don't have to
Do those.
consider that.
Okay.
Or we should reduce it.
So let's mention since other people tend to talk about it, not dentures, the
Veners.
veneers
the new
and
trend.
the
Okay.
and braces, right?
Okay.
Like I think most people think braces are needed when your teeth just sort of out of line or crooked a bit.
Right.
Or
But
if you want to follow the fashion trend.
yeah.
The floss.
Right. Oh, you want to floss?
Yeah,
the
right.
other
Like,
floss,
that's
yeah.
kind of a symbol
The
when they
other
have
floss,
it,
yeah.
right?
Yeah.
But in what cases is it recommended? Is it just to adjust teeth lining, or is there
The veneers?
overall the veneers or the
Well, I think veneers are like replacement because they kind of cap over the bone structure, the small
Yeah.
stuff
Well,
with the teeth.
well,
Is that-
you have different types of veneers. You have veneers that you have to reduce the teeth
Mhm.
a fair amount,
Yeah.
and you have veneers that you can
You
put
replace.
on.
Oh, you just tap it over.
You
it.
can put it on it.
Oh.
Depending, because some people have smaller teeth and their
Right.
mouth
Oh,
is
and it
big,
makes okay,
Yeah.
so
and you
it's
still have
kind
the
of
room
filling the
to kind
space.
of, right,
Oh.
right.
So-
But
No, so those would require a different type of. You still have to take care of the teeth somewhere, right?
What you mean in terms of the veneers?
Yeah.
Yeah, man, you definitely have to take care of them.
Okay.
But the thing with veneers, and we have to be careful about putting veneers on our teeth, because once if you prep the tooth, meaning reduce it, know that it's not gonna grow back.
Okay.
And what you put on is now man-made, and there's nothing a dentist can give you that is gonna be better than what
A regular teeth. Oh, okay.
Right. So where a veneer would be absolutely necessary. Let's say that the person had a case where the enamel wasn't formed properly on the teeth, and maybe it's discolored. Then that person would be a good candidate for replacement of the front of the teeth,
Right.
or even crowns maybe, depending on how bad it is.
Right.
But I've had a case where the child was a young child and they had a lot of enamel damage, or enamel hypoplasia we call it, but the enamel didn't form properly.
Yeah.
And so we spent a lot of time just replacing the front aspect so that he wouldn't get, because kids can have it.
Yeah,
So
that
we
is
had to
true.
replace the front.
Alright, well, I have the second to last question, and this one comes from the Instagram live. Whitening, teeth whitening, does it weaken teeth?
Weaken, I wouldn't say it weakens the teeth. So let me describe how the whitening works.
Alright.
So when you have the teeth, right? Teeth have these little holes that go directly into the nerve, right? And so over time, what happens is these holes, they become clogged with stuff, with food, whatever, right? Cells, whatever, everything, right? And so what the whitening does is the whitening uses a solution that actually goes into the pores and removes and breaks down what's in there. So you might get the white, like you just got the teeth, or maybe even whiter than that.
Yeah.
But in clearing the channels that lead to the nerve, it can cause sensitivity. So and how long that sensitivity lasts is really dependent on the person. So you have to weigh that carefully when you're deciding to do a whitening.
Okay, because I've heard mixed reviews about it. I've heard some dentists said no, don't whiten your teeth, go the regular way, go baking soda for it.
And it's for that reason, because it can lead to pain and sensitivity. Imagine you can't eat ice cream, you can't drink nothing cold because it hurts.
Yeah.
So it's
Okay.
it's food to thought before you go and do something like that.
Alright, well, to wrap up with my final question, I want to know more about your dental practice now. Because we can't just come and get all this wealth of information and not know if we have more questions, if we trust your information and we want to come find you. Tell us more about your practice.
Right. Okay, so we operate from Mandeville, Grove Court Dental. And we're right in the middle of Mandeville, right across the road from the courthouse. This side, what's that? Close to CIDC.
Yeah.
Right on the hill right there, in Grove Court Plaza.
And how long you been with this your practice?
Since 2020.
Yeah.
Since 2020.
Nice.
And how long have you been a
dentist?
DMD.
DMD. 2018.
2018. Okay.
2018.
Alright.
Okay. And let's wrap it up now with some final tips. Steven said, how can we book an appointment to see you and where do you practice? So he just said in Mandeville, right? Can you repeat the location?
That's 16 Park Crescent, Grove Court Plaza.
Grove Court, yeah, so that's Grove Court Plaza.
Right.
And we're gonna share this as well on our page, guys, at Funtastic 93 FM. So we do have a giveaway that we're gonna be advertising between tonight and the weekend. It's mainly for back to school, because we're trying to encourage kids getting into the habit.
Yeah.
So look out for that. But we're also gonna tag their information so you can always reach out. But outside of that, do you have like a number that they can call and get more information?
For sure. Do I remember it out of my head?
That is fine. In the meantime, I'm going to remind you guys about the 5 steps when it comes to cleaning. And as we said, this is his personal advice, right? So first and foremost, you brush with the toothpaste, right? You don't need the full toothbrush space there, I've learned. I have a debate to have when I reach home. And then, so you use a small amount. And then you brush your teeth, and then while the toothpaste is there, you floss. You floss with the toothpaste because it's good to get the toothpaste in between the nitty-gritty getting the work done.
Right.
Then you rinse, right? Then it's recommended that you brush a second time, once again with a small amount, because I think most of us are averse to it because we think to a mouthful of toothpaste. A smaller amount, or a similar amount, you brush again, and this time you just spit. You don't rinse it out because this acts as a protection to your teeth, right? And especially at night, while you're going to bed. Malaria,
Yeah,
right? Essentially, when you're going to bed. So, guys, I recommend that you try this starting tonight. I know that we're running out of time, but we will share. You can give the number quickly.
Yeah, man. It's 876.
Yeah.
835-9924.
So 876-835-9924.
Right.
Once again, we'll share the information on the page. We have to thank you, Dr. Ajani Blake, for the wealth of information. And we're going to work on it. Don't worry. We need to have like a series, at least every 3 months, with that. Share some tips, right? All right, we're working on it.
All right.
All right, thank you guys for listening. Thank you for the question. Thank you for the engagement. We're here at News Talk 93 FM every Friday from 5 p.m. to 8 p.m. Thank you for tuning in to Funtastic Friday.
Have a fantastic weekend.